Hi everyone, how you doing? It's a beautiful, beautiful day. Dr. Rob. It's CNY Fertility Sunday. KTZ Venice. Hello, Worldly. Ooh, all right. Let's see. My connection's a little poor, but we'll see how good it does. Last week I lost connection, but today I'm going to stay mojo. Mojoy. Hello, Rage Against Infertility. Mrs. Hello Kitty. All right, let's see what's going on with our internet. We'll figure this out. Hang on, guys. Give me one quick little second. It's we're on Facebook, YouTube, let's see, and Instagram. We got a lot of Instagram here. Facebook, I don't know what's going on with it. Maybe I'm on the wrong channel. Good morning, good morning. PS, our IVF journey. All right, there we go. We have some Facebook joining us. Hello, Samantha, Sarah. Angel, Elizabeth, good morning, good morning, good morning. Tanya, let me see what I got for my internet connection. Hold on, guys. It says it's good. We'll keep going as best we can, and if I need to, I'll switch to my other devices because we have lots of it. All right, good morning, Kristen, Tanya, Gabby, Kristen. A beautiful day, and we're sharing tips to improve your fertility. Natural, assisted, Eastern, Western, kind of bringing in all these pieces of the puzzle. You know how much I talk about anti-inflammatory foods. Kiltz's keto lifestyle. It's the Fertile Feast. Check it out on Amazon. You might find some really good stuff there. Let's see, 5-Star Beauty. We seem to have a good connection on Facebook today, but I'm going to stick with all of us and gratitude attitude. And I'm just really excited. We have some new stuff coming, but I can't let you know yet. We're working on our Colorado with Dr. Mangarelli, Dr. Fink. Dr. Joshman should be joining very, very, very soon. So I'm excited about that. Peachy Francis, Syracuse, very busy. Thank you for everyone's patience. Albany, Syracuse, Buffalo. Again, it's there. We just got to give it a moment. We have a little bit of sickness in some of our embryology team or some family things, and we're all family, and we all have to stick together and take care of ourselves and everyone together. Real important. Rachel, Devin, hi there. Let's see. I can't wait to talk either with you, Angel again. In between cycles now, doing FET in April. So whenever you're getting ready for doing, whether you're doing intercourse, IUI, or IVF, you're always preparing. If you're from retrieval to transfer between cycles, always want to focus on improving what's going on in here. It's the mindfulness. It's what you put in the mind and the mouth. And I wrote a book a few years ago called The Fertile Secret. And the secret is, it's all within all of us, by the way. That's the amazing part to the story. We have the ability to visualize the things we desire as if they already are, and they will be that or better. Never give that up. Faith is critical, no matter you're religious or not, spiritual or not. The positive attitude will help bring the things that you want more than anything. Well, will Healing Arts open in Rochester office? We should, Sean, be getting our Healing Arts team, our acupuncturist, massage therapist. We are limited there, but we should be all opening very soon. I've had my COVID vaccines twice now. I got a little sick after the first one, but I'm feeling much, much better now, and all is good. All right, thoughts on taking the mini pill before starting your IVF journey, taking it for a few months, Sarah Marie. That's okay. I'm not a big fan of the regular birth control pill. Mini pill for a little bit. I do a lot of estrogen, progesterone, and human growth hormone. I think that can be very helpful also. Kiltz's keto lifestyle. Vegan, vegetarian, Mediterranean, pescatarian, or carnivore, whichever you are. One meal, one snack. High fat, low carb, low protein. This is the craziness. So don't forget, you got to rest and get a nap in. And infinite mindful meditative visualizations of the beauty of life and what you desire. You have to have faith. The challenges that we all live, and we all live them, no matter who you are, you have hardships, and the hardships are a strong power to make us better, help us in this journey and push us. Waiting to CD1 to start my first IUI. Kristen, awesome. Check out Dr. Kiltz's Fertile Feast on Amazon. We're putting our family building guide. It's sharing so much out there. Go to our website, go to my YouTube channels, listen to my craziness. And again, I'm sharing some thoughts and ideas, whether you believe me or not. I'm just sharing my thoughts and ideas that I have seen game change. What we've been taught in medicine is wrong. It's opposite. We should eat one meal, not 3 to 6. You want your glucose levels to stay low and have a spike once a day. That is it. And it's a high fat, low carb, low protein. I personally do mostly a carnivore keto, but this term keto, we're going to blow it out of the waters. I don't even believe it mostly. All right. Cramping since my transfer January 29th, 5 days late. Should you be worried? Mrs. Hello Kitty Bish. Well, I don't want you to worry, but this is where we have to check for an infection in your bladder, intra-abdominal pelvic, vaginal infections or inflammation. These are factors. And if you haven't gotten your pregnancy test, are you on your medications? Do we need to change them up? All these things are critical and important that we need to check out. So, give us a call. We'll take a look, have someone take a look wherever you're at. All right, Brandy Champagne. First FET failed 2 to 3 day embryos, good graded 2 to 8. Not sure if I should do another retrieval or transfer or last 3 graded. All right. I flunked out of kindergarten and first grade and beyond. I can tell you our ability to grade and look at an embryo and tell whether it's good or bad is piss poor and not good. So every single embryo has the potential to become the beautiful baby you desire. Don't give that up, by the way. And so every embryo in my heart deserves the chance to be a baby, and it must get into a uterus in order to be that. So it's your choice if you want to go ahead and do that, or you want to go do another retrieval. Don't forget laparoscopy, hysteroscopy for endometriosis. Don't forget it's anti-inflammatory. Keto is anti-inflammatory, and Kiltz's lifestyle, I should call it Dr. Kiltz's fertile lifestyle, which is basically lowering inflammation by increasing fat, really critical in all of this. But then there's the anti-endo medical treatment. And unfortunately, the Receptiva DX doesn't tell you you absolutely don't have it. A negative test still may have a 20% of people that says, hey, there's no endo there. They have it. I personally recommend either treating with 2 months of Orlisson letrozole or a laparoscopy hysteroscopy. Now you can use Lupron or with letrozole instead. But then there's the antihistamine protocol and the antimicrobial protocol. And if you go online and look at all my stuff, you'll see the immune 1, 2, 3, and 4, which the 4 is IVIG and Humira and possibly LIT, which is kind of hard to get these days because all these borders are closed or hard to get to. So, but absolutely, an embryo to have a chance must be put in. And how many times do we delete pictures that we thought that's ugly, 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 but it's a picture of you or someone you love, but they just kind of turn here or there and a little crazy, by the way. You guys doing good on this beautiful Sunday. Love every day. Transfer January 18th, HCG over 8,200. And we saw 2 yolk sacs, chance of vanishing twin syndrome, possibly. Stay on your meds. Go to 8 weeks at least if you're not sure. These HCGs sometimes are funky. But, if you don't see a heartbeat by 7 weeks, it's not good. But, this business isn't, we're not exact. We're not 100%. Let's see. Can you do PGS testing for gender selection? Yes, mini IVF protocol. In my opinion, it's across the board. I love it. I do a lot of it. I think no matter what your diagnosis, mini is great. I got to encourage all my doctors, all these crazy protocols. Mini, letrozole 10, gonal orfalston 200, HCG 20. Really, really great. Or gonal orfalston 150 and Menopur 75. But it really is a game changer in my opinion. High doses, I don't love. Lower doses, I think, are better than anything. It's a crazy concept and idea, but we got to look differently. Let's see, the little uterus that could. I'll see you tomorrow. I'm there until about noon. I have to go to the hospital, do a few surgeries. I still do surgeries. A lot of laparoscopies for endo, fibroids, or just diagnostic. I think it's critical. Talk to your OBGYN. Hey, I have infertility, and Dr. Kiltz told me that a laparoscopy, hysteroscopy may help me get pregnant. Well, you have no symptoms. Oh, wait a minute. Infertility is the leading symptom of endometriosis. And endometriosis is intra-abdominal pelvic inflammation. It's so simple. Let's see. I just had FET. You guys are good. Very crampy. Got that. Let's see. Ovulated during last FET prep. So started 10 units Lupron, CD3, now CD61. Okay, look, get an ultrasound and blood work. If you're not getting a period, don't wait. Ultrasound and blood work. If it's a thick lining, then you go on a week or 10 days of estrogen, progesterone, and stop it. Or you get a laparoscopy, hysteroscopy. This waiting for your cycle days, everyone, please get me an ultrasound and blood work because we're not waiting. We're going to start kicking that menstrual period out of the water, in my opinion. Get baseline, start Lupron a week before your period. If you're not getting it, get an ultrasound and some blood work to take a look and see what's going on. All right, let's see. All right. Heather, do mini IVF with AMH of 0.003, FSH of 20. All right, you can do it. No, listen, I always say when you have numbers like really low AMHs and high FSHs and really evidence of a lot of ovarian intra-abdominal pelvic inflammation, keto. We've been talking a lot about ovarian bloom and our, let's see if you can see that. I'm not even sure I got it right. Let's see. There we go. Ovarian bloom, DHEA, and keto. Then this is where HGH, human growth hormone, for 30 days, estrase, prometrium for 30 days. Then go right into a stimulation. Do not wait for your period. Do not say, oh, I want to do a fresh. Go right from that and start your Gonal 200, Letrozole 10. You could use Clomid 100 to 200 also, by the way. And then the HCG 20 low dose. That's what I recommend. And you never know what the numbers mean until you do something. But the really low AMHs and high FSHs, you've really got a lot of inflammation. And this is where intra-ovarian PRP, intrauterine PRP. And I really believe that the antimicrobial, the antihistamine, and the anti-endo can work very nice also, by the way. Hoping for bank sent. All right, let's see. You guys are doing good. I'm working to calm down, slow it down. All of us need to do that every day. The more we focus on meditation, prayer, and positive attitude of life, that's what each of us must do in life. If we don't do that, it doesn't work. I know, it's crazy, right? So the more I've been reading this one by Carolyn Larson, 1 Minute Devotions for Women. I love Sarah Young in Jesus Calling. But no matter your spiritual belief or not, find something positive to listen to read, to bring into the mental construct, because we're all thinking in worried words and thoughts and fearful worried words and thought. We have to have faith in the way the universe is creating all things and recognize that we are part of that beautiful, amazing universe. Let's see. Should I stop Lupron to get a period again? Stay on the Lupron, Wendy. Get an ultrasound and some blood work, by the way. You guys are doing great. Let's see. All right, let's see here. We have Talisha. Hello. Next month consult. Testing comes back. Good, and only factor is my past tubal ligation. Mini protocol be good. I think mini protocol is really great. And sometimes my doctors are like, I don't know, that these protocols were all over the place, all of us, by the way. And why? It's because it's our habits. But 10 Letrozole, 200 Gonal, 20 of HCG, antagonist, HCG trigger. Really works great. Some Lupron also, because if your estrogen or your number of follicles is too high, we're worried about the risk of hyperstimulation. We're working to keep it low. Fertility treatment and COVID vaccine. COVID vaccine or COVID virus, which would you rather? Currently, I generally recommend the vaccine, but you have to go by your own thoughts and beliefs. There are allergies to vaccines for sure, but is the COVID virus worse to get? Again, I'm giving you my opinion. I think the vaccine is reasonable even if you're in preparing for this fertility treatment, but no one knows this absolute answers. Christine O'Nair, how can I keep it at bay? Should I decrease the water intake? Oh, look at OHS says is due to chronic inflammation in all of us. In my opinion, it's a high carb, low fat diet and eating like a grazing animal. But you want to trigger with Lupron only if there's really high risk, or Lupron, but a small amount of HCG or Avidro. All this weight-based stuff is getting everyone confused. If you're doing 150 of Avidro plus 4 milligrams of Lupron, that's enough, in my opinion. If you're at high risk of hyperstim, at least one of Lupron and a very small amount of HCG or none, I think it's the way to go. Local pharmacies to see who had it. Empower Pharmacy may have some HCG, by the way, but this is where Avidril 1 or 2 comes in, by the way. We're all working on positivity. We have troubles, all of us, but the universe says this one's for you. The problems are the presence of God, and whatever your belief of God is, God knows best for all of us, and have faith. Don't lose this. How many fertilized donor eggs would you recommend transferring? 1 donor egg fertilized embryo, 2 at the most in general. There's some individual reasons why we might do 2, but it's a rare one. Well, I have a period right after the active weeks of birth control are going to start without it. You don't have to have a period, and you don't have to go into the placebo from the pill. You can get your baseline oxygen bloods if you're on the birth control pill or esterase or prometrium, or you're not getting your period. We do a lot of luteal phase starts, 1 or 2 do starts. I think the esterase prometrium is a good priming with some human growth hormone, and then get your baselines and then just get going. And the baselines are just to give us information to know where you're at. We should be looking at AMHs a little bit more, but even if you have a high AMH, mini protocols, letrozole, 200 of gonorrhea and HCG 20. Dr. Chang, please look at that. I know we like to do what we've all been taught, but I believe so many of us were taught incorrectly. Let's see, ovarian bloom, been on it 2 months. Is it good to regulate cycles? I've been having erratic cycles. It's good. I also think that the molecular fertility supplements, male and female, and guys, get off the treadmill. Kiltz keto lifestyle, I'm a carnivore. I do a little bit of French fries from time to time, but mostly 1 meal at night. It's a kick-ass, most amazing thing you'll ever do. I'm really working on Dr. Kiltz's YouTube channel to try to share more and more ideas of health and wellness, whether you're infertile or not, whether you're simply working to live a more fertile life. We are more like lionesses and lions. We are not like pigs and cows. Dogs and cats are carnivores, but they're fed grass and grains to get all the diseases we get. I believe we're more like carnivores in our gastrointestinal tract. If you insist on being a vegan or vegetarian, and I honor your beliefs, by the way, 1 meal, high fat, low carbs, low protein, cook the carbs well and add the fat, coconut oil, coconut milk, hemp seed oil. But if you're a vegetarian, it's butter, cream, eggs. I know. And lean meat is not good for us, by the way. Fatty. That's the best thing. We all need the fat. Without the fat, we die. And being overweight, as people have labeled it, is not causes of disease. It's what's in our bellies. And by simply getting rid of what's in our bellies in 2 weeks, 2 weeks of Kiltz's Keto Lifestyle, you can get my 2 books. One is Fertile Feast and Dr. Kiltz's Keto Lifestyle. It's crazy. We do not burn sugar ever. There's no such thing as insulin resistance. And I know this is crazy, but fat is the fertile fuel for the body. And if you're overweight, it's because you have the best genetics ever created in this universe. That means you are capable of living through the famines and being able to reproduce where the skinnies did not. And no matter your size or shape, these ideas are game changers. They're anti-inflammatory. I'm a reproductive immunologist. I'm a reproductive endocrinologist. I'm a gynecologic, minimally invasive surgeon. And I believe I'm a nutritionist. I read everything, but I practiced it myself. And don't believe me, but practice on yourself. You're the N of one. Keto is a low carb, one meal a day, high fat, but still one meal, two at the most. Craziness, I know. Let's see. MDR's HCG, thanks. Jeff from MDR, we're grateful. We're always looking for something else out there. All right, Bethany, Prometrium ideal prior to mini. I think estrase and Prometrium, along with HGH, are good for the low AMHs, DOR. 99% of our body's vessels are capillaries, the microvessels. They're the ones that get damaged. So we need to reduce the glycation and the damage to glycocalyx. Just look up glycocalyx. It's crazy. We've got it on our website. Our YouTube channel is going to be talking more and more about it. We're bringing your health and wellness to the game changing. We're supposed to go days, if not weeks. All right, I'll give you days without food, but not 5 hours, 12. I do 24 hours essentially. To make it possible to prime whenever you choose. Again, I think estrase 2 milligrams, Prometrium 200, or 4 milligrams of estrase and 400 of Prometrium with 3 to 6 units of human growth or omnitrope can really be helpful for DOR, by the way. Endometriosis, it's intra-abdominal pelvic inflammation, it's bowel inflammation. The colon, with all the fiber, fruits and vegetables, seeds and nuts, are fermenting and making heat, alcohol, aldehydes, methane gas. That's the cause of all disease, by the way. Let's see. So I have a period right after active weeks. I already answered that. We talked about, we'll have that. Let's see. To stim when choose rather. Bethany, again, I think our stimming needs to be just any time. And if you're pushing to, I want to do a fresh transfer, this is where either right with your cycle start or you're doing estrase, Prometrium, or the birth control pill. But I don't love the birth control pill. This is something I generally talk a lot about. Let's see here. Hey, Rob and Nikki, how you doing? Hypothyroid and my levels have been adjusted to 100. Levothyroxine, my TSH levels are 0.93. James says good, yes. Or is that too low? No, you're still good with those numbers. So I think that's good to stay on it, by the way. Let's see, Anastasia. Hello. It's our pleasure. 24 weeks. And when you're pregnant, the anti-inflammatory kiltz keto lifestyle is critical, in my opinion. Don't start going to all the seeds and nuts in 3 to 6 times. It's one time. We are increasing inflammation through the bodies by going standard diets, by the way. CBD oil, I think CBD, LDN throughout pregnancy will help reduce inflammation, by the way. All right, let's see, what do we got here? All right, Lena, cycle after molecular fertility pills. So do we go into a treatment cycle right after molecular fertility pills, whether cycle comes or not? Yes, these are essentially the prenatals, the pre-pregnancy, the pregnancy supplements. Now, if you're really doing the liver, the bone marrow, the eggs, the cream, the fat, you're going to get the minerals and vitamins that your body needs, and you don't need any supplements. The plants are the poisons, and they're the predators that are anti-nutritional, and they bind the minerals and vitamins in our GI tract, and they go right out the other end. That's the craziness. And they damage the glycocalyx, and they cause the inflammation that is so common in our bodies. Amy, give me 1 second. I'll be right with you. Let's see. I do not work out. 0. I am creative every day. I am either doing my pottery, painting, talking to you guys. I'm reading something that's going to be very meditative and healing and help me realize that my troubles are just in my brain. And there's some person out there that wrote some words that'll make me feel better. And so that's what I do with my days. I love my work. My work is my art. I am grateful to be able to have my ability to share thoughts and ideas, but I stopped working out, doing the treadmill and all that stuff and the weights 10 years ago. Back pain gone, arthritis, psoriasis, kidney stones, and migraine gone. Never felt better, ever. All right, recommend for type 1 diabetics, 18 years, A1C, TTC 2.5, AMH, no cysts ever. My beautiful sister Marianne died of diabetes. Take insulin 3 to 6 times a day or continuous pump, add more sugar. You're dead. It's not good. So absolutely for type 1 diabetics, keto concept. Remember, in my opinion, you got to be careful on the ketos, but look at Maria and Craig Emmerich's stuff. And I love Maria Emmerich. She is amazing. Carnivore, but she has some other books, by the way, on standard keto, which I think are very powerful. But in my opinion, one meal, one snack, you will use less insulin, you will reduce the inflammation, because you as long as you take insulin, either a pump, you must continuously add sugar. By adding sugar to the bloodstream, it damages every organ, including the testicles, the ovaries, the brain, the pancreas, and everything. So you can go into a cycle, by the way. I do recommend a mini protocol. I recommend an immune 3 protocol, which includes things like Neupogen, Plaquenil, Prograf, aspirin, Lovenox, prednisone, all of these things. And obviously, diabetics have a little bit more problems with the steroids. We have to be careful. But I personally recommend hysterosalpingogram, saline sonogram, and or a laparoscopy, seroscopy. I think they're all good. A lot of inflammation we're missing in men and women, by the way. Guys, the male molecular fertility. Kiltz's keto lifestyle. Keto will get rid of hypertension, diabetes, in many cases, by the way, unless you trash completely your pancreatic islet cells. Just like if you've trashed your thyroid, you need the supplements, but you need far less than you know. When you eat fat, you don't require insulin. When you eat protein and carbs, remember, all plants are carbs, are sugar. They just don't look that way to you on the plate because you've been taught the opposite and wrong things, in my opinion. Now, who am I? Just a doctor that practices this for many years. Oh, check out Ken and Nisha Berry. They're rocking amazing, have really great things to share and show for it. And this stuff is really crazy. I've learned this over many years of practice. I started medical school in '81 in UC Davis. I then went to do a year of internal medicine at Sepulveda VA, UCLA program in LA. I then went to do a year of OBGYN at USC Women's Hospital. Let's see, that was 86, 87. Then 87 to 90, I went to University of Colorado Health Science Center. Had my beautiful daughter Pilar back then. And then went on to do my fellowship at Harvard UCLA in 91 to 93. And then I've been out in upstate New York since 95. And we're really sharing some thoughts and ideas that are completely opposite that I learned in medical school and residency and most of my training. And check out my books on Amazon. It's really game changers. Check out Ken Berry's book about the lies we've all been taught and sharing with you that turn out to be wrong. You can, let's see, you should see the SAC next ultrasound. You guys, thank you everyone, by the way, for sharing answers to all of this. I really appreciate it. You guys are amazing. And to the women of color sharing a new support group, to all women and men, whether size, shape, gender, age, weight, description of your relationship, it doesn't matter. We at CNY Fertility are here to help and integrate everyone. And we all need to be more integrative and diverse in all things in our lives, loving, accepting, and kindness to everyone. That's the most important thing. But the most important person to love is you. You must start the day with, I love you, thank you. And God is the great creator within all of us. And these are all game changers that I've learned in this business. Oh, Don Clark and Jennifer Waters, Diane Credenza, Heather Smith, our acupuncturist, amazing. Our CNY Healing Arts team has been helping for ages and ages, and so blessed and grateful to all of them for integrating Eastern and Western medicine together. Massage, acupuncture, prayer, yoga. Oh, Erin McCullough, thank you. I appreciate it. You are amazing. Let's see. Is it normal not to see gestational sac at 5 weeks? Angelica. We love to see it at 5, but it's not always there. Stay on your medications, by the way. If we're not certain, stay on them. Even if the level HCG drops a little bit, reminding our entire team, just stay on your meds, okay? We're gonna just have to watch and wait and be patient. This is where HCG boosters, Neupogen, Lovenox, aspirin, Plaquenil, intralipids, IVIG, 20 grams every 2 weeks until 14 weeks, starting about a week or two prior to transfer. I think it's good. But remember, if your intercourse cycle or IUI cycle or a sex cycle, I think intercourse, I mentioned that, or your fresh or frozen cycle or gestational carrier or whatever it is, inflammation is the cause of all of our problems. Weird and crazy. I know it didn't make sense to me until I just lived it and changed it up. It's crazy. Let's see. Got your book, Lap Hysteroscope. Tomorrow, what can intralipids, Neupogen, immune protocol help recurrent implantation? Ricky, look at all of these things. I call it the blanket approach, right? We don't like shotguns because they hurt, right? But hugging and comfort and love is so critical for all of us. We all need it, right? We're herd animals, and this COVID craziness has been really challenging. And so, again, to Sarah, Trish, Sarah, Amy, Jen, Keisha. I don't even know if I have all my OR staff names in Syracuse. They're amazing. I can be a bear some days, but I just want to throw out my gratitude to them and to my docs at all levels, to all my teams at all places. Gratitude and thank you for being so caring to all of our patients. It sometimes is a shit show, all right? I mean, fertilizer, it smells sometimes, but really all these challenges are the best that we can ever do, by the way. Cutting in and out. I apologize, the cutting in and out. If I lose you guys, I'm going to change maybe my internet. Give me a second on this. So hold on. I'm going to come back, I think. Let me see if I can figure out my internet. Don't leave me, everyone. Wi-Fi. Let's try this one. Let's see if I can get you guys back in a better one. All right. All right. Let me know if you still have me on the Instagram. I apologize. I was trying to get a better connection, so I apologize. Let's see if it comes back. Let's see. Strong mommy to be. Let's see. I suffered a cystic tissue and stim. I suffered of cystic tissue. Stim meds have added more. Is this normal? I'm not sure. Let's see. Are we doing it? I'm not sure I understand. Start the aspirin and the immune protocols early, by the way. A breast. Oh, cystic tissue in the breast. Yeah, a lot of estrogen stimulation. Look at these organs, and our emotional body is highly affected by this stuff. But the breasts, for sure, are going to be affected by these hormones. You know, to me, it's still a lot of inflammation is part of the issue. This is where low dose naltrexone. I think 3 milligrams is enough, but some take a lower 2, some take 4 to 4.5. Inflammation success rates adding Neupogen injections along with trigger shock to frozen embryo transfer. There's the problem with these things and the data. I call most data doo-doo, and we don't really know. But if what you did before didn't work, we're going to add some other things and see if we can help out in this mix one way or another, right? Laparoscope, what are candidate syllabus immune protocol, help recurrent plantation? Certainly, I think all of those. Look at my downloads on level 3 immune protocol, and I personally say yes, because look at, we're doing IVF. Isn't that a lot of intervention? All right, Stephanie, so tube open, no defects in uterus. Let's see, saline ultrasound show uterine volume. I don't look at that. Let me add echo textures, heterogeneous, small hetero focus in endometrium. What could it be? Fibroids, adenomyosis, trying to conceive, reversal, baby number 2 for you, 2 years, had cervical polyps removed last May. I think you just need a hysteroscopy. Take a look in there. Hysteroscopy DNC light, by the way, is the only way to know. If there's any, see, the saline sonogram is a screening test. If anything's weird in there, do a hysteroscopy, because otherwise I don't know what it is until you look inside. Thank you to Tia for taking good care of me. I'm a workaholic. My life is challenging, and I'm so grateful to her for taking care of me. And every day I'm grateful for everyone that helps take care of me, because you guys are amazing. And if I don't say it, show it. I'm grateful. And again, thank you. Thank you for everything. Oh, our pleasure, Strong Mombi. We're doing Lovenox, Neupogen, HCG. Don't forget the antimicrobial protocol, the antihistamine protocol, Plaquenil. And look at Kiltz's keto lifestyle is crazy, crazy, crazy. I'm not sure I've got my book here. Oh, don't forget the LDN book. It's really good. Amazon has it. And don't forget, get yourself a journal. Write in it every day. And you want to be positive in your writings and thoughts and ideas. But yes, sometimes you'll have anger, sadness, regret, and judgment. Put it in there and then burn it up, because we need to focus more on all the good things. Do you think keto, look at ketogenic diet, all right? And there's lots of them. Look at Dr. Kiltz's Keto Cure and Dr. Kiltz's Keto Lifestyle. Personally, it's all anti-inflammatory. Eating fat reduces inflammation. Ultimately, fat is from animals. Oils are from plants. It really is a high-fat animal, in my opinion. Low carbs, low protein, in my opinion. And it's one meal. But keto helps reduce inflammation. The inflammation is what causes miscarriages, which causes DNA abnormalities of the sperm, the egg, and the embryo, and kicks out your fetus. That's the crazy story to all of this. You know, it's just amazing. Yoga and lifestyle, Markham. Let's see, in Canada, what clinic do you recommend that doesn't discriminate against women in their 40s? Let's see, Genesis, our CNY fertility partner in Montreal. You know, they're all good docs up there and good clinics. And simply ask them, I'm 40, 41, 44, whatever it is. Can you guys help me and take care of me? Whatever your age, size, shape, weight, gender, color, it doesn't matter. Whatever who you are, you're a human being that deserves, from doctors, nurses, professionals, everyone, love and respect. And that's our challenge, all of us. Keep going. Increase LDS. Let's see, Strong Mommy, LDN, 3 to 4.5 is good, yes. If you go from 1.5, then maybe go to 3. If you're tolerating that, that's a good dose. I think you could go to 4.5. The LDN book on Amazon is really good. You should be able to click on this in a link on our website. Will and the team are working on making our website better and better and better, giving you, your friends, your family advice free advice, by the way, for your health and wellness. Whether you're attempting pregnancy or you just want to feel better in life. Listen, we all want to feel better physically, emotionally, every which way. I wrote my book, The Fertile Secret, after reading The Secret by Rhonda Byrne. If you haven't watched it, listen to it. You must. It really is helpful. I love it. All right, you guys are amazing. Thank you for joining me. Where are we at? 10:40. I can go on and on and on. And all my doctors, Dr. V, Dr. Magarelli, Jennifer Waters, Allison, Elizabeth, so many doing lives for you through CMI Fertility. Danielle is going to be doing those along with Christine. And we really need to be better on listening to your feelings and share them with us. You know, there's no guarantees in this journey that what we're doing is going to make a baby, unfortunately. But there's a greater power driving and leading all of us. And find that spiritual power that you can walk with in life every day. And know that God is within each and every one of us. Faith is first, always. You must hold faith. And food, those two things, faith and food, will be the guide to your fertile life. And whether it's to conceive and have a baby, or it's to simply be healthier, it's quite an amazing story that I've learned. All right, who benefits from a natural FET? Alyssa, potentially everyone that has regular menstrual cycles and is not likely had multiple repetitive losses or other evidence of inflammation. Remember, ALS, MS, psoriasis, kidney stones, irritable bowel, colitis, Crohn's, migraines, Sjogren's. They're all inflammatory conditions caused by a high plant-based, low-fat, grazing animal diet. But I believe that natural is something we need to look at much more. And it may be just doing the level 1 immune protocol or none of the immune stuff. But if you have a tubal ligation or vasectomy, and we're using epididymal sperm, or you do an IVF because you just had a tubal ligation, there may be simply, let's watch your regular cycle, watch you ovulate, and then plan the transfer from there. If you're doing an endometrioreceptivity assay, you have to trigger or be on letrozole or estrogen, progesterone, and I do recommend those treatments, by the way. And we're working to continue affordability, quality, and access. We ask all of our anesthesiologists, thank you for holding your prices down. We thank the pharmacies that are keeping their prices down to make fertility more affordable. In my opinion, low dose is best for everyone. Tell the doctors, the nurses, everyone, I want to do the low dose, the mini protocol that Dr. Kiltz recommends, which is either letrozole 10 for 5 days, Clomid 200 for 5 days, with Gonal 200 or Follistim 200 plus HCG 20. But again, you could use high dose or low dose. You can even go lower. I believe the 100 units is too low for most people in IVF because we're at least trying to get 8 to 10 A's, not 1 or 2, unless that's what you want. I was raised Catholic. I became an atheist, agnostic, spiritualist, Buddhist, Kindist. I believe in the Spirit of God for all of us. I practice mostly Christian philosophy, but I think wherever you're at in this journey, faith, faith, faith. And the positiveness of our brain is faith. That's God within all of us. That's the amazing journey. And science, my friend, is simply spiritual belief like anything else. That's crazy, right? All right, let's see. I'm not sure. Casing increased sperm count. All right. Let's see. This might be backwards for some, but it's snowballs. Cool the sperm, right? You cool the pack. You put it in the briefs, right? And it could be chilly down there, right? Cool the nuts off, right? Seeds and nuts, by the way, will damage your nuts. But Kiltz's keto lifestyle first. The male essentials second. get off the treadmill, slow it down. Kiltz is keto. And also Clomid and HCG or letrozole 2.5 or Clomid 25 with or without HCG 250 units a day can boost your sperm. Hey, doctors, nurses, Dr. Kiltz said, I can try this to help boost my sperm. Yes. You should look at your thyroid, prolactin, get a testicular scrotal ultrasound. You guys, the same damage to eggs and the same damage from sperm comes from a grazing animal diet. We are not grazing animals. Our DNA is that of a feline, lioness, wolf. It's crazy, I know, or an eagle, right? If you choose to eat like a vegan or vegetarian as an herbivore, one meal, high fat, it's crazy. And I absolutely respect what you choose. I'm simply giving some ideas that you might simply see, Dr. Kiltz, you're crazy. And I was accused of being insulting on TikTok. And please know this, I'm simply sharing thoughts and ideas. I respect and honor everyone out there. And I'm simply throwing some ideas that I'm so passionate about and dramatic, as you know, that it's like crazy as a physician. And look at, if you just look at Ken Berry sharing the thoughts and ideas he's doing, which is all about carnivore, but intermittently fasting, I don't call it that. I call it intermittently feasting. You want to intermittently eat, not intermittently not eat. I call it intermittent feasting, one meal a day at night, fattiest ribeye with butter and salt. I don't put spices. I dip it in butter and I add duck liver or beef liver or chicken liver, but you must eat the fat in the liver and the bone marrow and the bone marrow soup. Bone broth has all the minerals and vitamins your body needs. But when you add all the vegetables, if they're uncooked, they're worse. They will deplete your body of the things you need. This is the craziness. Let's see. All right. Haley, first frozen embryo transfer. Fail. You did my transfer at the end of January. The only reason we were doing IVF is because my husband is paralyzed and we have sperm frozen. What can we do differently now? Next transfer, perfect embryo last time. All right. Go ahead and download or buy my books on Amazon, Dr. Kiltz's Keto Lifestyle, The Fertile Feast, and watch my stuff on this video. So all of us are inflamed. Now that can damage a sperm, an egg, and an embryo. And we have to imagine it's always egg, it's always sperm, it's always embryo. But this is where I think you need to look at the immune 3, the immune 4. Don't forget mindfulness. So Kiltz's Keto Lifestyle, and I should get rid of the keto part of it because ketogenesis is kind of a misnomer. We don't burn sugar and then burn fat. We always burn fat. You want to keep your glucose levels down, automatically your ketones are high. We always make ketones. So what I'm talking about here in these failures is you want to change your diet, change your mind. You want to look at the immune protocols. It might be that you have endo and need a laparoscopy, hysteroscopy, or the 2 months of medical therapy with Orilissa or Lupron and letrozole. It really, really, really is a game changer that I learned that changed my life. And I'm just so amazed for all of this. It's Samara, Pierre, thank you very much. We all need to bring more love, more kindness, more generosity, more gratitude to our days. That will envelop our lives in a more positive way. And whatever comes to us, we will see with a different light. That's really the critical part to this. So, embryo glue is used for everyone now. And so again, look at our family building guide, which is also going on to Amazon. Listen, it's just a great way to get it to everyone. We really try to keep our fees low for everyone, payment plans for everyone. I cannot guarantee egg, sperm, or embryos. This process of medicine is very, very, very imperfect. but we're really, really excited about Sarasota coming soon, and our Atlanta, Dr. V and the team getting going on retreat, at least transfers in the next few months down there. And again, to everyone out there, talk to your OBGYN. If they have an ultrasound machine, can they help monitor and be part of the wave of keeping fertility more affordable for all of us? I grew up as a kid in LA, kicked out of school, couldn't read, father in jail, and I've learned in life that suffering is the present that sharpens us and hardens us, but not hardens us to be negative, but shines the light that is really powerful us to learn and be better in life. And if you haven't read Joseph Campbell, you must. Oh, and The Alchemist, amazing, awesome, awesome. Is there hope to change my protocol, make more follicles next time? Jenny, so duo stims, triple stims. I do a lot of it, by the way. So it helps, I think, one stem, another stem, another stem. And this is where, again, ketogenic lifestyle, Dr. Kiltz's ketogenic lifestyle reduces inflammation. Kiltz's keto lifestyle is one meal, one snack, and I do a lot of naps, all right? And so sometimes I take a 5-minute nap, and Ashley, they shut my door. I do my 5-minute meditation, prayer, visualization. We need to do much more of that, infinite times a day, right? But really critical that we pull all that together. Let's see here. CBD have better effects than Oralisa. I believe, let's see, chili bean cocoa. Yes, CBD oil. We're working on getting our CBD oil out there in the world. We're having some challenges. We're going to make it happen. But CBD, keto, kiltz is keto, kiltz is keto, kiltz is keto. Now look, I'm just making it up because it's fun. You have to have fun in life. The more fun and joy in this crazy challenge, right? And I've got problems, big time. Dead people don't, and I'm not in a rush to get there, by the way. All right. So let's see. Devin, Tessie surgery, do you guys offer it? Testicular epididymal sperm aspiration. That's what I call it. We do testicular aspirations through the PESA, microaspiration of the epididymis, and we also do the transcutaneous biopsy. Dr. Trussell also does an open biopsy, but we're not doing the 8-hour microscopic. We found you can get a lot of sperm simply by doing the percutaneous biopsy. Really, really helps. I personally believe this is where keto, LDN, CBD, critical. Kiltz is keto, critical. And then the other idea is HCG 250 for at least 3 months to 6 months with Clomid or letrozole can help. Let's see. Husband 0 sperm count due to testicular anchoring surgery, age 10. High FSH, recommend we try surgery, get sperm, and go straight to donor sperm. Listen, Devin, I always recommend, listen, you never know what's in there. These numbers don't always tell us the answer. Simply, LDN, CBD, keto, molecular fertility supplements, HCG, Clomid or letrozole, and then stick a needle in it. And if that's not working, yes, do an open biopsy. That can really help. Gratitude, attitude to Dr. Trussell and my urology team, Sarah G. and my team in Syracuse for taking care of Trish. Again, I'm not naming everyone's name. I apologize to the team. And I sometimes get a little crazy, and I apologize to my amazing team every day if I'm a little crazy. All right. Lewiston, Jen, I've been on HGH for 8 weeks plus THC 75, 6 months. My period has stopped. Think it's to do with that. Never missed a period. Ultrasound and blood work. Take a look. See where you're at. No one knows that for sure. It could be, but I don't care so much about your period in the sense of starting anything. So I'm trying to get my team is call with your period. No, we'll get an ultrasound baseline here. Estrogen, progesterone, HGH baselines. Then start your stims. You can even stay on estrogen, but stop the progesterone. It's a great way to go. You guys doing okay? Thank you very much for sharing. I really appreciate it. I've been sharing for a few years. I started doing my daily intentions about 15 years ago, and I wrote my daily intentions book. I've got my new daily inspirations book out there because I love to share the ideas of health and wellness, first in the mind, then in the mouth, and how you move the body. Go for a walk in nature. Go out and watch the stars and the sunset. Slow it down. Go for a light bike ride. If you're really pumping and pumping and pumping, you're heating up the core. Guess what that's going to damage? Inside you. The 5 causes of all inflammation: carbohydrates from plants, the antigens from plants and bacteria and yeast, the chemicals from plants. They make pesticides, by the way. The fermentation of the plants in the bowels, heat gas, alcohol, aldehydes, and exercise. I know I used to be a crazy man on all this stuff. It's deadly. My best friend Dave Kilmer, lymphoma 52, I'm unfortunately convinced that our healthy diet recommendations are the cause of every disease we have. I'm sorry. Again, whether you choose to be vegan, vegetarian, Mediterranean, whatever your cultural beliefs are, keto can be done. It's anti-inflammation, 100%. The best thing I've ever done. Do it in one. If you insist on a snack, okay, but make sure it's high fat. All right, let's see here. Chelsea Nicole, PCOS. PCOS, it sucks. You're right. What the you know what? All right, PCOS, polycystic ovarian syndrome. It's caused by high plant-based, low-fat diets, my friends. Same thing. It's a metabolic disorder caused by inflammation to the microvessels in the ovaries, in the capillaries of the pituitary and the hypothalamus. It's systemic inflammation and damage to the glycocalyx. Just Google glycocalyx and the glycobiome, by the way. But it's simple. You can kick ass on PCOS by going keto. I believe ketogenic diet lifestyle, I'm going to use the word, cures so many diseases, and I believe that PCOS is one of those. And I know, listen, don't believe me. But the moment I did it and all my bowel bleeding stopped and arthritis and kidney stones and everything, backaches, gone. I know I'm a pain in the ass, and I apologize for anything I say that might seem insulting. As a physician, I honor all of you, every one of you. And so I'm grateful. But one thing I've learned is our diseases that we label are due to the diets we recommend. Our mothers ate them. They damaged us inside in utero. We were fed vegetables since we were born, and we are not soy-based eaters. We're fat-based, milk from breasts, okay? Not from a bottle, but if you insist, you want to make sure you're getting the fatty cream from the crop, right? That's it. It's nutty, nutty, nutty. All right. Heather, thank you for your question. Let's see. Mini IVF safe for me since I've had a PE during cancer treatment. All right. Remember, cancer is caused by inflammation. A pulmonary embolus is caused by inflammation. But mini would be good, I think. 2 calcified cysts taken out of my left ovary. Doctor saw when he was counting my follicles Friday. Let's see, would that help anything? I don't think so. The calcified cyst may be fibrous. It's okay. Supplements. All right. Supplements. The ovarian bloom and the molecular fertility female. I believe LDN and CBD are really, really helpful, by the way. That's what I believe. Slow it down and keto. I know. Rock on crazy. And bless you for surviving it. All right. But you have to look at the movie, the Magic Pill. Crazy, amazing. Don't give up on that baby. It's coming. But look at our website, Molecular Fertility. Low AMH and high FSH. What supplements should I take? This is where the human growth hormone is one that's people are like, oh, if you've had cancer, don't take it. Cerevital is an oral HGH, but I always say kiltz's keto lifestyle is key. Cancer is caused by glucose and the plant phytochemicals, not the pesticides sprayed on the plant, but the pesticides that the plants make, because they're the predators that want to kill us and disrupt our reproduction. But absolutely, I think mini would work really well. Letrozole 10, you can even do 5 for throughout the stimulation. That's okay, but I love the 10. You can even do 25 one day and 25 another. These procedures and protocols we're learning, we're sharing, are rock solid, amazing, game changing, by the way. It's the most amazing. If an egg is retrieved immature, mature within 2 hours and fertilized, yes, Mercedes, good question. Listen, trigger shot 34 to 36 hours later generally is a retrieval, although there's a wide window, by the way. And we trigger with Lupron and HCG, or Lupron Avidril, which is HCG, or just HCG, or just Lupron. We mature eggs. If they're not mature right away, we mature them in the dish. We've had maturity the next day. It's rare to get no mature, but we change it up. We look for different things to do in this whole mix. Crazy, amazing concepts, right? Let's see, Lacey, I did IVF, currently 12 weeks, scheduled for a C-section for this baby. After him, can I transfer another embryo? Now, my brother and I are we're 10 days shy of a year. I was born March 12th, and he was born March 2nd. So my mom only waited 3, but that wasn't a C-section. I recommend 3 to 6 months. 4 months to 5 months is a good in between, but talk to your doctor. We will take care of you and transfer anywhere between 4 and 6 months. I think that's reasonable. Ashley, a week after retrieval, yes, pressure is very, very common, Ashley, because your ovaries are stimulated. You're bloated. That's going to be a factor for sure. All right, it's 11:02. Thank you very much for joining me, by the way. Less than 200 after estrogen, progesterone, does it have to be high dose? Yo-ya 4612. Low dose, low dose, low dose, low dose, mini dose. Kiltz is mini. Kiltz is mini, I'm going to call it. Kiltz is mini. 10 of letrozole, 200 of gonorrhea, 20 of HCG, antagonist, HCG Lupron trigger. Home run. Love it. For anyone with high AMH, low AMH, in between AMH, it's everywhere. All right, I'm glad I finally got my connection a little bit better, and I know my stuff sounds crazy, but I'm passionate about you. My compassion is what I'm continuously digging deep for all of us. Dig deep into compassion for yourself, my team, other patients, all of us in this globe. We need more of it in this COVID craziness. Every single day, we need to bring more of it to the day. All right, one more. Jenna Davis. Hi, Jenna. Is there any way to increase sperm morphology? Okay, absolutely. The male, let's see if I got this right. Male molecular essentials, okay? The light's a little blurry on that. I apologize. LDN CBD, Kiltz's Keto Lifestyle. Get the book on Amazon, read it. It's a game changer in my opinion. And at 55, I did it. I'm now 65 in about 4 weeks. I've never, ever felt better in my life, more energized, more joyful. But remember, what you put in the mind and the mouth will take care of everything good and bad. So absolutely, guys, you can help. Oh, and then there's the snowballs, the cooling pack for the testes. Get off the treadmill. Stop pumping iron a whole bunch. Go out into nature for a light walk. Enjoy slowing it down and cooling it down. All right, everyone. Mercedes, Karagina, Kikers, thank you. Jenna and everyone, Ashley, to everyone, my blessings and love and kindness. To all the other fertility doctors, thank you. Look at all of us, whether you're a naturopath, a chiropractor, an acupuncturist, or you're bringing your ideas through the internet today and being supportive. Check out our Fertile Spirit now with Danielle, working to share more and more and more and more loving, kind, generous ideas to you and everyone. I'll see you guys. I hope you guys got as much as I honor you to give every single day of my life. God bless you guys. I'll see you later. Take care.